Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. My honor to be back with you again for another Friday video update where we attempt to tell you about what's going on in healthcare and with the Washington Health System. Most of my update today is about COVID, as you would expect. First and foremost, we've been trying to be as transparent as possible with everybody in the community and within the organization about what's going on with COVID, because we think that helps build trusting relationships, which allows us to help care for you and your family in these dire times. With that in mind, I want to be transparent about my own situation. About 2 weeks ago, I started developing some minor symptoms, and I followed our protocols and procedures where I immediately went home from work. We've been telling people if they're sick, don't come to work, and if you are here, go home to prevent the potential spread of that illness to others, and I followed that guideline as well. In addition to that, I followed our process and notified our employee health department, who ran me through the algorithm to determine whether or not I need to be COVID tested, and they did in fact test me, and it turns out I was positive. So I immediately went into isolation following the CDC and our internal processes, and I worked from home from the last 2 weeks and returned to work Wednesday this week. My wife and I did have some mild symptoms. Thankfully, that's all it was, and I was allowed and capable of working from home, and I worked with our senior leaders to make sure the organization continued to provide great patient care to everyone involved. And I'm thankful to the many team members who reached out to check on my wife and I during this time. But we are doing well and back to work, and I wanted to acknowledge that and let you know that it did impact us as well. My family has been religiously following the CDC guidelines around social distancing, hand hygiene, and mask wearing at all times in public. And in spite of that, we still got infected by someone. We'll never know who. So I want to encourage everyone to be safe. Be careful. You never know if you're going to be exposed at a gas station, a restaurant, or even by a family member at home. And it's important that we all be as careful and safe as possible when you can. With that in mind, I want to give you some other updates about COVID, starting with our testing rates. We have been consistently testing. We've tested over 14,000 individuals since the beginning of March. We haven't been testing more than normal because, unlike what you hear, we don't have unlimited supplies to test anybody and everybody who wants it. But our testing rate, our testing cases, has been consistent. In spite of that, since the beginning of the year, our positivity rate at our outpatient drive-up sites has been around 2%. And in the last month, that's increased to about 7%. So there's no doubt there's more infectious people in our region right now than there has been in the past, and you need to be careful. Because of that, we've also seen an increase in the number of people who are inpatients. From March until the beginning of October, we were seeing somewhere between sometimes 0, but as many as 5, 6, or 7 inpatients who were confirmed positive on any given day. In the last 3 or 4 weeks, that's been averaging over 20 per day. Now that seems extreme, that seems like a lot, but I want you to be assured that we are perfectly capable of handling that. We are not out of supplies, beds, or resources. We're far from it. Matter of fact, all the plans we put in place in March and April to plan for a surge are still available if we need them, but we don't even have enough cases to implement most of those surge plans. So we're capable in handling the crisis, the increase that we're seeing. Now, it's not fun. Our most limited resources are people, and we have a number of staff and physician vacancies like all healthcare organizations, and it's tough to recruit people during this time to come work at any organization, including our own. And so we're not being stressed by the number of COVID patients coming in or by supplies, but I will admit healthcare employees are tired. Ours are as well. And it seems like a small thing, but it is a burden to have to wear all of this PPE, all day long, taking care of all of these patients, and it just wears on you after a while. And so I know our team is stressed and tired, again, not because of the number of people, but just because of the constant environment we've been working in since then. So I want to acknowledge and recognize all of our wonderful, amazing WHS team members, not only people who care for COVID patients, but for those who don't, because we're all doing a tremendous job taking care of our community at this time. Now, from a testing perspective, the turnaround time remains about the same, meaning we only have capability of running about 32 inpatient tests on our machine today, and we can get that result in about 4 hours. But we can't get any more supplies from the vendor. We did order a second machine that could arrive any day or maybe never. If that machine arrives and we get no additional supplies, it's a big paperweight, admittedly. But we're taking a gamble that that machine will eventually show up, and hopefully the supply chain situation will improve, and then we can run more tests in-house. And again, we'll do as many as we can on that. But because it's a limited quantity today, we're only running patients on that machine who are ED patients who we know are going to be admitted, people who are already admitted to the hospital, or healthcare workers who were exposed. All other samples are being sent to Quest. So on that in-house machine, we can get the results in about 4 hours. When we run the machine, we run it 2 to 3 times a day. Everything going to Quest is taken on average about 2 to 3 days to get their result back. Both Quest and our in-house testing is PCR testing, which is about 97% accurate, the most accurate testing you can get. So we're following up on that as much as possible. Now, we do have some capability of doing rapid antigen testing. We have the machines and some limited supplies for that, but we haven't started it yet for 2 reasons. One, we don't know if we can get any more supplies. But most importantly, what we're being told from the CDC and the Department of Health is if you run a sample on that, the advantage is you get the result in 15 minutes. But if you run a sample and it turns out it's positive, then it's positive. There's no arguing it, even though it's only about 70% accurate. So if you think it's a false positive, the government's saying you have to call it positive. That person has to go into quarantine. You have to do contact tracing, all of those issues. If it's negative, and the vast majority should, right, because only about 7% are testing positive right now, then all of those have to be rerun to validate it on PCR testing to confirm it's right. So then you're using double the supplies. And so we have not started using the rapid antigen testing. I get a lot of questions from people about other organizations in the Pittsburgh market who are using this rapid test. Why aren't we? And the reason is we don't have enough supplies, but more importantly, it's not that accurate, and you'd have to rerun the sample and use double the supplies on all those people who are negative. And we're just not sure that's best use. We think that gives people a false sense of security. Although we do have it, and we may decide to use it in the future. But the problem, I guess, the bottom line is testing is not available to anyone and everyone, and it's still a problem nationwide. We're doing the best we can, and please bear with us. Now, from a testing site perspective, as you know, we've had 2 drive-up locations, one in Washington County at the Wellness Center and one in Greene County at the hospital. And as winter weather approaches, we want to move those inside. So just this week on Monday, we moved the Washington County site at the Wilfred R. Cameron Wellness Center from outside to into a portable trailer that we have parked to the left of the Wellness Center. We're scheduling people to go there instead of driving up unscheduled. It takes a little bit longer. When we were doing it with people in a car, it took about 4 minutes to do the test, start to finish. Now it takes about 11 minutes. The main difference is we have to clean the space between patients. That's really the biggest difference. But that started on Monday. And we're going to start doing in-house COVID testing on patients down at the Washington Health System Greene, probably mid-December, again, to move them from outside to inside the building. In addition to that, we're getting ready to start our respiratory clinics. These are set up for patients of our physician offices. So if you in the past called, again, respiratory illness of some sort, cold, flu, strep, or now COVID, and you would just call and go see your primary care physician or your doctor, we don't want you coming into the physician offices and potentially exposing other patients or our staff. And so we're going to set up 2 respiratory clinics, one in Washington at Neighbor Health Center Building 2, one down in Waynesburg at our Washington Health System Greene Outpatient Center. These are going to be staffed by our WPG and family medicine residency faculty, physicians, and providers. So the same people who are caring for you now. If you call our offices, have one of these respiratory symptoms, we'll send you to these clinics first where they can test you for flu, strep, or COVID. And then once they determine what your issue is, you could go back to your normal primary care doc without infecting others. Those are both going to be up and running roughly mid-December, maybe slightly earlier. With everything going on and the increase in cases in our area, we want to just remind everybody to be safe. Be diligent. In spite of doing everything we could in our family, we got infected and had to deal with this, and we don't want anybody else to go through that. So remember, hand hygiene, social distancing, mask wearing are all still extremely important in all venues, and so please continue to do that to try and keep yourself safe. With that in mind, we still have restrictions on visitors at the hospitals for inpatients. And I know that these visitation restrictions are not fun, but we've gotten an increase in the number of complaints recently by people who want to come visit COVID positive patients. And just as a reminder to folks, these people are infectious. They can pass this deadly illness on to you and others. And so we don't allow visitors for COVID positive people. And I understand as a family member, as a loved one, that is extremely difficult. We're doing that for your safety, the safety of our community. Now, I will admit we have some minor exceptions. We've had some patients at the end of life where we've helped the family get enough PPE to come in for small visits to visit with their loved one before they got to the end of their life. And we'll continue to make those small exceptions, but we're not going to make exceptions for a normal inpatient who will be discharged and go home. And so I know that's difficult again, but I want people to know we're doing this for your protection. We're not doing this to make your life difficult. And so bear with us. Please understand that this is about protecting you in the community. It's not about trying to make your life difficult. We understand it's a burden, but we'll continue to work with you on that. In addition to all that, we want to remind people to continue to seek care. If you have a medical emergency, don't put it off. Don't be concerned that you might be exposed to COVID and put your life at greater risk. So if you need something, remember our emergency departments are still open, physician offices. Matter of fact, all of our clinical services in every department are fully operational and available to you and are safe. All those protocols and policies we put in place early in the year to help protect you and our staff and the community are still in effect. It's a safe environment to come get care. We want you to come in. We're willing and capable of taking care of you in a very safe environment. We're following all the CDC, state, and federal guidelines. And if you're interested in our protocols, you can go to our website, whs.org/safe, to learn about what we're doing to help keep the environment safe for you. We're having everybody who comes in the building continue to wear a mask, and all of our employees are wearing masks and or goggles depending on their role and whether or not they're going to be exposed to people or not. Your safety and the safety of our patients and our staff are our number one priority, have been way before COVID existed, and will continue to be going forward. That's our first priority, and we'll continue to do that. So stay diligent. I know this is a long, tiring, painful process. It's not going to go anytime soon. It's going to take every one of us in the community to help fight the virus, to keep the numbers down. So continue, as I said earlier, mask wearing, hand hygiene, social distancing, those are all going to continue to be important. Keep your head up. Let's all stay strong as a community. We can get through this together. I hope you found this video helpful. I appreciate you spending a little time to watch it. Our next video will be next week. We're going to have a video every Friday. But my next video to give you updates about what's going on is going to be the first Friday of every month. So the next one for me will be December 4th. Until then, stay safe.